How are you doing? I am Dr. Dante Morrison, and I am inviting you to a conversation about HIV and AIDS. I invited a few close friends to come to the table and sit, and we're going to unpack HIV, sexual health, the Black community, Black family, and a lot of other interesting conversations that will just tie in the mental, sexual, spiritual health of our community. So you will see through this engagement that you will learn about HIV, learn about pending ways of treatment and prevention. You will learn about some of the systemic factors that play a role in why people are still getting infected, and you hear from multiple voices at this table over a phenomenal meal about what we can do to help decrease the rates of new infections. So please join us, Marcel Wellness Center, the HIV Vaccine Trials Network, and my village as we talk about HIV in recognition of World AIDS Day 2024. So let's get into it. Have a seat. Here we go. So, hey, it is World AIDS Day 2024, and I invite you all here to have this conversation. And I believe that we're going to go deeper than just put on a condom.
Absolutely.
You're going to go deeper, right, go deeper than just get tested. Because there's a lot of stuff associated with HIV that we oftentimes do not discuss, especially within our own community. A lot of intergenerational trauma, intergenerational misteachings, the mental health aspect, the spiritual health aspect, why people are even still putting themselves at risk. It's not just because they don't care. Right. They do care, but it's other factors. So you are all handpicked to be here for this conversation. And before we go any further, let's just take 30 seconds to let the people who don't know who you are know who you are. So not to be sexist, but let's do ladies first. right. First thing. So let's start to my right. Just who are you?
All right, I'm Kiana Shaw. I am the owner of KRS Training and Development, where we teach youth, young adults, blue collar workers, and those who are justice impacted or spent time in a gated community. Right, I like to say that other than jail. People tighten up when you say jail. We help them with work readiness, personal and professional development. I am also the creator of Mothers Raising Teen Daughters, which is a community of about 26,000 moms who just need support in bridging the communication gap between them and their daughters, bringing love, joy, and harmony back to their homes.
I love that. I love that. My sis to the left.
Hey guys, so my name is Miana, and I am the founder and CEO of Thickness Fitness, which is an inclusive wellness brand, and the new developer of Graceful Meditations, which is a branch of Thickness Fitness. I inspire the plus size community to be loud and take up space in a world that is designed for us not to, while we work on bettering ourselves and showing up as the best versions that we possibly can. I understand that mental health is the way to achieve that, so I started Graceful Meditations, which is just a way to remind people that they're enough every morning.
Yeah.
And so that is what I do, and I just want to make people feel seen, heard, and valued in everything that I do. That's all.
Wow. I love that. Then my brother from another mother.
Okay, so I'm Kente Williams. I moved here from New York about 6 years ago. I have an MDiv from the Union where I studied Bible because I have trauma from my family that told me that I was an abomination. So I wanted to do a little bit of study and found God and found me, and we have been aligned ever since. I work in entertainment. I work at a law firm, and I'm your, I think, everyday community regular dude. I spend my time with the ballroom community. One, because I love the performing arts, but two, I like the people. And I want to find a place where I can contribute and be present for people. So that's my way of giving back.
I love that. My other brother from another mother, one of my closest friends, Dr. Leo Moore.
Hi everyone. So I'm Dr. Leo Moore. I am an internal medicine, HIV medicine, and lifestyle medicine physician based here in Los Angeles. Wanted to be a doctor since I was 5. Became a doctor when I turned 25, and I'm the first doctor in my family. So with that, this is work that I've been passionate about all of my life. I also am a member of the United States Presidential Advisory Council on HIV and AIDS, a federal advisory committee that reports to the Assistant Secretary of Health for Health and Human Services. And a fun fact, I was recently named Men's Health Magazine's Ultimate Guy.
Okay. Oh,
Come on,
good for that.
But you see, we got no excuse.
Come on, I'm here for thickness fitness.
Thank you.
Right. And this is funny to my mom. My mom will always say, "Yeah, I need to talk to a doctor. Not you, Dante. I need a real doctor. Call Leo."
Oh no.
Oh, so my PhD is just.
She's right about it.
Yeah, she right. She said, "I know you a doctor, but I need a doctor.
Doctor.
Okay.
Okay. All right, well, you call Leo then.
Yes.
Do that. And then last but not least, the infamous.
Oh wow.
Infamous? That's
Wow.
nice.
Oh, that's good. That's
It's
powerful.
wicked.
No
No,
one judges
it's
it.
wicked.
Infamous means amazing.
God bless you. Infamous, there's a lot.
The right kind of doctor.
Sir.
Well, Martinez solo español. No habla nada español. But I get the honor and privilege of serving as CEO of Marcel Wellness Center, where our passion and desire is to transform the world through the power of wellness. And my other brand is Mental Health Marty, because I want to help Black men deal with their mental health, because too many of us are secretly suffering in silence in the shadow of shame. And so I'm trying to help men speak up, speak out, so that they can live. And so we are trying to live our best life. So that's what we do. Here, here.
I love that. I love that. So raise a glass on behalf of y'all.
Yes. Come on, come on.
Why is
We'll
that?
give you some
I
other
don't
shade.
know. It's empty. It's empty.
I welcome it.
Right. Neither one. I'm just empty. But let's get into it. So World AIDS Day is huge. I mean, it's a
Yes.
global awareness event where the world kind of pushes the brakes and tries to educate everybody. But outside of World AIDS Day, HIV is a problem every single day. You know, it's kind of like when you see people, let's go feed the homeless on Thanksgiving. Well, they're going to be hungry again in February, March, and April. So we can't just talk about HIV only on World AIDS Day. It should be a continuum within our communities specifically. But I want to ask the table, you know, is everyone abreast of what HIV is? And I ask that because I do a lot of talks about HIV, and you know, Dr. Leo, you know, we're both versed in it, but you'll be amazed at how many people still do not know, one, what HIV even stands for,
Right.
two, how it's transmitted. You know, so I won't put nobody on the spot, but
I'm like, I know what it
Right.
is. But now I'm on the spot. I'm like, the H. What?
Right.
It's the virus.
You know, and it's like, oh, and
You
it's
know,
two
the
doctors at the
deficiency. I
clinic.
said,
Right.
it's the H. I'm
Right.
yeah. And when you think about that, you know, that most people still do not know what HIV stands for. Human immunodeficiency virus.
I knew it. I was right.
Yeah, they scratch their temples, and it's something because Dr. Leo, when did it come out? When did it become mainstream?
So in the 80s, 1980s is when it was first discovered. And, you know, since then we've had so many advances, but many people aren't aware of those advances. And I just want to go back to, you know, one thing that you were saying that I think, you know, is so important for us to be thinking about when we think about our community, is that outside of, say, Black LGBTQ folks, Black women and Black men are also getting HIV every year as well. So this is not just for one group of us, it really is for all of us, you know, to be aware of HIV. You also mentioned how it's transmitted, so I just want to briefly talk about how it's transmitted. So we know that it's transmitted through sex. It's also transmitted during pregnancy from mothers to children. It's transmitted during injection drug use or sharing of drug paraphernalia. In the past, it was transmitted through blood transfusions, but through science and advancements, we're now able to detect HIV in blood to prevent HIV from being transmitted through blood. So over these years, a lot of advances, but there's a lot of information that we need our community to know so they can make the best decisions for themselves.
And I think you said something really important too, because most people, when they hear sex, they'll be like, okay, well, I'm not having gay sex.
Right.
And I always clarify, there's no such
There's no
thing
such thing.
as gay sex. It's oral, anal, vaginal.
That's it.
It can be the anus of a man or a woman.
Mhm.
But
So
people
doggy
get-
style ain't a
A missionary,
Okay.
reverse cowgirl, all those are positions.
And none of those are excluded.
Right. Be clear.
Right.
But I think it's important because people still have that idea like, oh, well, that is gay sex. I'm not having gay sex,
Right.
so I'm cool. And Mark, you finna say something?
No, what Dr. Leo was just talking about, it originated in the 80s. I lived through that at being at UC Berkeley and seeing, I lost count of about 100 people that I knew who had died from this. And in 85 to 90, when I was at UC Berkeley, they were really literally dropping off as flies, and it was just uncontrolled. Literally within 6 months, I'm like, where's so-and-so? Oh, we covered it up a lot, especially in the black churches, saying they had pneumonia. Well, it wasn't pneumonia. They had HIV. And even the churches that refused to bury their same people that were participating in their choirs, or were participating in their usher boards or anything else, and how the stigma that came along with it, I helped perpetuate that we have not let go of today. And so my heart just bleeds for all the people that we knew that had such bright futures, still had bright dreams, whether it was right, wrong, or indifferent, and then those who were very ostracized. And maybe that's getting one of my biggest fears in life is dying alone because of so many who died alone in hospital beds and all that because people were too afraid or they were just ostracized and their family members gave up on them. But we have to be better than that today.
Yes.
But I think you brought up a good point, and I want to ask the table: is AIDS still a thing?
Yes.
Yes. Is it talked about though? No, not really. Like it's a thing for sure, but I think it's probably more whispered about than spoken about. Like you're not seeing it go across social media like that, like you used to. So yeah, I don't know.
I think that it's lost its status as a killer.
Right.
Okay.
Okay.
Right.
And so because it's lost its status as a killer, and what's been added to it are preventative measures, then it's not the same kind of threat. So it won't get the same kind of attention. It's like red, orange level threats.
Yeah, DEFCON 1 and
Yeah.
5.
Right.
Yeah.
And I think people look at it in the yellow zone versus where it was in the red zone in the 80s, early 90s. Yeah, I agree with that.
I do too.
I agree with that as well. And I think because many folks that are of younger generations did not have the experiences that you shared. They didn't see friends and family lost, right? So
And there was no conversation in recent days. Like back then, our grandparents, our parents had conversations, at least in my household. My grandfather was like, look, this is what we need to be talking about as a family. That did not happen in my friends' families. But when we're looking at the conversations that were had because it was so new versus now, most people don't address it. Like I address it with my daughter because I have Dante.
Right.
If I didn't have Dante, I don't know that I would tell Kayla and talk to her about this kind of stuff.
I'm glad you look at it that way. I don't think we still have the conversations because even at the funerals or whatever, we were like, now they didn't have pneumonia. We did not openly
Not
talk
just
about it.
gossiping about it.
But it wasn't. But it really was secret gossip.
Right.
Yeah.
That only a few knew. Now, they up there lied. We have to stop lying and perpetuating this and really talk about the truth of the matter and really talk about the preventative measures, like you're saying. I think that the opportunities to talk about is out there, but we're still ashamed and still not having these conversations because I think what you're saying earlier, you say gay sex or this, and we still have labeled it a certain way.
You know, I have 3 daughters, and what I've noticed now that we're talking about it is when I'm speaking to them about protecting themselves, I don't single HIV out. Whereas if we were back in the 80s or even the 90s, we would have singled HIV out from the other STDs.
Yeah.
Now, they're just all STDs. And I've never once had a conversation with my daughters about HIV specifically.
Wow.
I've only ever had a conversation about protecting themselves from all STDs and from anything that would get them sick that they cannot give back.
Wow.
That is the way that I put it. You don't want to get something that you cannot give back. You know, you don't want to get something, period.
Right.
But you definitely don't want to get something you can't give back.
Right.
But I am not. I noticed I've not ever just had a conversation about HIV and AIDS just in my lifetime with them.
Also, when we go to the doctor, you know, and we're like, hey, it's my monthly or yearly checkup, and I want this STD panel.
Mm-hmm.
A lot of people don't know they have to ask for HIV and herpes testing,
Mm-hmm.
Really?
right? You have to ask. It's not included in
Is
the
this true?
panel. No, and not at all. So if you're not aware, and then you go, okay, I'm free and clear,
Mm-hmm.
and then you find out that it takes HIV 3 months to show up in your blood test.
Mm-hmm.
So if you was, you know, getting dug out last night, that's like, you know, next month, it's
Right.
still not showing up. We don't know this information. So because we don't know it, especially as women, we're just like, we're good.
Right.
We're good. Men chasing us all the time. We're good, right? So I think that the health community has to do a better job of saying, hey, you know, if you are active, we suggest it versus waiting for them to ask.
I 100% agree with what you're saying about physicians and other providers leading that conversation. And not even just about testing, but about sexual health overall.
Yes.
About sex, healthy sex, pleasurable sex,
Right.
in addition to talking about disease. It's not all
Right.
about disease,
Agreed.
right?
Yeah.
And that if they're testing you for your annual, as you mentioned, to actually talk about what tests they're ordering, so that if you want additional tests ordered,
Okay.
you've heard what all is being ordered, and you can say, I want this additional test.
Right.
You know, because for us, I don't usually order the herpes test for every patient because herpes is very, very, very common, and we often have people who will never actually have symptoms of herpes. So
You said very, 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 very common.
Yeah.
There was a lot of very.
Yeah.
I just thought you had common, but you had about 10 berries before that.
It's very common, and one of the reasons it's underdiagnosed is there are many people who have herpes who will never have a herpes outbreak.
Yeah.
But once you
Shut the front
have
door.
Right.
You better leave in because you need that in. You flip
Because recently someone said, I was watching something. It wasn't on the internet, but someone said that like, was it hand, foot, and mouth disease and chicken pox are all forms of herpes, and I haven't researched that part yet because I'm
Well, we got
like,
the doctor here.
right. So I'm asking for research, right? But is that a thing? Because if all you've ever had was chicken pox,
Mhm.
and you don't know that that's her, like, is it?
It's a different type of herpes. It's a
Okay.
different type. So chicken pox and shingles are herpes zoster. And then you have the other herpes viruses that are for our genital herpes. So either genital herpes, so there's HSV1 herpes.
Which is like a cold sore.
Yes.
Okay.
One is usually a cold sore, but you can actually get one also in the genitalia as well. So there's HSV1 or HSV2, and 2 is usually in the genital area. But, you know, you can also get 2 in the mouth
Yes.
as well.
So I'm laughing because remember on Beverly Hills Cop?
Yes.
And Burke was like,
Herpes
you got
Everybody simplex 10.
So I assumed that the 10 was the genital herpes. My bad. But this is why we have these conversations.
Right.
So we can be
Right.
informed and not share this information,
Right.
misinformation with our
Right.
kids.
Right. Absolutely.
But just to close out that one thought about it being, it's so common, and there are many people who have it who will never have symptoms of it, that once we diagnose you with it, you have to disclose it to everyone, and you may not be infectious and you may not ever have an outbreak. So we give patients a choice. Would you like to be tested for this today? Because once you're tested, and if you test positive, then it is your responsibility to disclose that to every person that you're having sex with.
Right.
And there is a lot of stigma around herpes that
Yeah.
people don't think about,
Yes.
in addition to the stigma of HIV.
Yeah.
And so that's one of the reasons we don't do the herpes test regularly. Now, the HIV test, I completely agree with you. One of the challenges I sometimes hear is that someone will say, oh, well, I asked them to test me for everything, and not knowing what all they tested you for. So my recommendation is always to say, if you're saying test me for everything, and by the way, what are you going to test me for today if they don't tell you that?
Okay. But Leah, you made a very powerful statement, and I think a lot of people don't even realize you just said it. When you were talking about herpes, people says, "Well, I don't want to get tested because I don't want to know." That happens with HIV a lot.
Yes.
You know,
Happens with everything.
when I worked in the clinic, I had a lot of people come in and says, "Yeah, I don't want to get tested." I'm like, "But you out there having sex?" "Yeah, but I want to know if I got it." Because if I know if I got it, then it's gonna one, make me accountable, and then two, I'm gonna instantly get in my head and say I'm dying. Oh my God, I'm dying. I'm dying. So I'd rather not know that I have it. So they avoid testing altogether. You
And I
know.
think it speaks to the truth there that we still don't have enough education because
Right.
today we know it's definitely treatable. And it's not the death sentence like it used to be. However, we got to get it early enough so we can make it preventable.
And I think you also said something about, and medically, I want you to clarify this. Do people die from AIDS?
So, AIDS, keep in mind, AIDS is a classification.
Yes.
HIV
Yes.
is the virus. AIDS is a classification, so it means the person's viral load, the number of copies of the virus, is less than 200, and that they have an opportunistic infection. So, if you get a cold, and you're not living with HIV or you're not living with cancer or other diseases that weaken your immune system, then you could fight off a cold easily, right? But a person with a weakened immune system due to HIV could die from pneumonia. They could die from the flu. They could die from COVID, even, for example, more easily. They could die from the common cold more easily. So that's what I mean by opportunistic infection. And so AIDS is a classification. We are not seeing as many people dying from AIDS. But I do want to mention to you all, when I was in residency, one of my friends, someone who actually had gone to public health school while I was in medical school at Morehouse, he died from complications of AIDS.
Wow.
Due to the denial of having it and the shame, the stigma. So this is still very much real. People are still dying from AIDS. Although we don't hear it talked about as much, it's definitely still happening.
Thank you. And can we just bless this food? Oh my God. 'Cause, you know, I was trying to pay attention to everything too. But when I saw them shrimp and grits, I was ready to slap somebody's
I've
mama.
been checked out since the biscuits.
Well, let me conserve my words. If you checked out.
Right. So, you know, as we do, we bless our food at all times. Let's just bow our heads. God, we thank you for this meal. We thank you for this conversation. We thank you for this community and village. Lord, bless the hands prepared it and let it be nourishment to our bodies. In your name we give thanks and praise. Amen. Amen. Shout out to Eddie's Edibles. Eddie's Edibles for the shrimp and grits and catfish and
It all looks
eggs and
amazing.
sausage.
Yes.
Yes.
That's a good thing.
So I think we're really on a good pace right now when we're
Yes.
talking about this. I mean, we know how it's contracted. We know it came out, 40 years ago. We know that people are scared to get tested. They're not getting tested. You want to add?
I was gonna say, I've been asked by doctors when I go again through education, right? I always ask for HIV, herpes, and I've been asked why. Why do you want those, right? And the why is very shocking to me because it's almost like, well, what do you need that for? You understand? Well, because I'm sexually active.
Right.
Well, because I've been in a relationship, but I don't know who else he's sexually active. Right. And so, I think that there is still shame even inside the medical community.
Yeah. There's a lot of shame. There's also a lot of, but you also got to understand, every single doctor is not an HIV specialist.
Okay.
So sometimes I have to go to a primary care physician for anything outside of my diagnosis. Then I have an HIV specialist that deals with the virus only.
Okay.
So my primary care physician knows nothing about my HIV care. It's like a divide. Now, I don't know if it's because of the network I'm a part of, but my primary care physician has no knowledge of HIV.
I do want to mention, though, you should never have to explain why you want sexual health screening.
Right.
So I'm not gonna make an excuse for my colleagues in that regard.
I was
She's
trying
not
to
my
show
doctor
grace.
anymore.
Okay.
I was
Okay.
trying to
Because you should never have to answer why. Sure, you may get questions about your sexual history, right? Because they're wanting to make sure that they are testing you regularly based on your sexual history,
Right.
but not why, as in why do you even want
Right.
that test?
Yeah.
You know.
Yeah, I was very uncomfortable in that moment. But I have come to realize that that is how people still see.
It's the taboo of sex that is still very much there. And it's not only, out in the community, but it's also in healthcare, right? The people who are trained as physicians, nurse practitioners, physician assistants, they came up through our same education system where there was not standardized, sexual education, right? So these conversations are still very taboo in medical school. Sometimes you have people snickering during those conversations,
Wow, really?
like because they're just not used to it because it's not been normalized and the conversation is still too taboo. So I think it really starts off earlier than where we're starting in this country with conversations even about a healthy body. Right. So that people can get more comfortable with the body and not be so kind of nervous to talk about it.
Right.
And to add to that, you all are aware there are people out there that actually want to contract HIV.
What?
Yeah.
Please explain that one.
There are
Right.
people out there that
What the
want.
hell?
They are trying to contract HIV. Bug chasers is the slang term for them. But there are individuals
This.
that when it comes to HIV, it can lead to a better economic status. If you're someone who's homeless, living on the streets, don't have access to housing and whatnot, if you contract HIV, you'll get housing. You'll get certain medical care, you get certain privileges, you get certain things.
Wow.
It's a survival tactic.
Jeez.
And I've come across a lot of individuals whose friends may have housing assistance or they get food assistance because of their status. Meanwhile, they're struggling and living on the street, sleeping on the sidewalk. And they've said, Dante, I should just catch it. Let me catch it so I can get an apartment as well. So that's a reality.
So I'm
And
gonna get
it's
something
systemic.
that kills me, so I have an immediate refund.
It is a
But-
failure of the system.
But it goes
Okay.
back.
Right.
It is
goes-
a failure of the system.
But it goes back to what Kente shared about HIV is not looked at as that death sentence that we've been preaching that for decades. It's not a death sentence. So if I know it's not a death sentence, it's not going to kill me. My friends are living well in their government paid for apartment and they're getting food every single week. I'm out here, y'all give me a condom. Okay, fine, I'm having safe sex, but I'm homeless and I'm hungry and I'm this and I'm that. There's benefits systemically to contracting HIV.
Jesus Christ.
It is a failure of the system
I agree with you.
that people even feel that they have to chase HIV in order to get housing, get food, get transportation, get those living essentials, right?
Living
So
essentials.
it to me just speaks back to the very broken, not only healthcare system, but social services system that we have in this country.
Right.
But that's why I think, and I totally agree with you, why this conversation with all of us and our different areas of expertise, collectively, we can help in the stigma. Even if we help change 3, 4, 5, whatever, and that gets pushed out. So we can help in Apple Valley, so we can help in the IE, so we can help in LA, because we're all too interconnected. Not to have these conversations, they cannot happen in silos anymore. So thank you, Dr. Dante, for having this, because we can look at even the greater problem.
Right. I was thinking, when I was coming up, I think I disengaged in the conversation, if I'm gonna be honest, because I'm thinking like, okay, well, why haven't I done these things that we're talking about? Like what would my reasons be? Because I don't have a Dante, right? Well, I do now, but I didn't then. It all became very confusing talking about it, right? Like, let's say you want to get the information so that you can be an advocate, so you can be an ally to the community. Well, I got lost in, well, if one person with HIV has sex with another person with HIV, and they may not have the same HIV, and so now it's you can catch another type of. I was like,
Strange.
I couldn't. and it was never explained in a way that I could understand and reasonably regurgitate to someone else and sound like I have some sense, you know? So I think I disengaged from the conversation simply because I didn't have enough understanding, and that's partly my fault as well. But even now, if the average person, like, it's just not talked about enough for us to be able to, again, talk to someone else who doesn't know. And like, I just learned in the last 12 months that they have something called PrEP. In the last 12 months, guys, I don't know how long PrEP has been out or has been a thing, but I've only recently learned about it. And I understand that I don't have HIV, and I don't know anybody immediately, you know, other than my bro here who has it. But still, shouldn't we all know? Like, shouldn't the information be available where we kind of all can, like, know the basics of how to, because how do you prepare and how do you properly protect yourself if you don't really know exactly what you're protecting yourself from or how the protection comes about?
You were on all of my segments.
Oh, I'm sorry.
No, that was great. No, that was great. And I think yes, we're going to talk about PrEP, PEP, biomedical, all of that. But I think it really boils down to our communication.
Right. Yes, and to
within
your
our
point,
own communities.
I just found out within the last 2 months that there's PrEP for women. I had no idea. I thought PrEP was completely for men.
Oh.
I did not know. Like, again, the education. We don't know what we don't know, and we don't know what to ask about if we don't know.
Well, let's dive into it then. Let's go. Let's go.
Let's you and Dr. Moore.
Let's right.
Right.
Dr. Leo, what is biomedical HIV prevention?
So I'm glad you asked. And honestly, from the time that you spoke about your daughters and not talking specifically about HIV, I was wanting to have this conversation because we now know that there are those tools that are available to protect people from HIV specifically, right? And so that's where PrEP, or pre-exposure prophylaxis, comes into play, and PEP, post-exposure prophylaxis. So pre-exposure, before exposure, prophylaxis medication used to prevent. So medication taken either daily, or now we have an injectable version that's taken every 2 months to prevent HIV.
Wow.
And it decreases the risk of HIV up to 99%. We can't say 100%, but you know, as close to 100% as you can get in preventing HIV when taken as prescribed. And so a major game changer, and what I love that has been done recently is broadening our guidelines so that it's very clear that it's not just for LGBTQ folks.
Right.
The guidelines say that if it's a person who's having condomless sex regularly,
Everyone.
Right.
people who are having condomless sex with multiple partners, people who may have an HIV positive partner or may not know the status of their partner.
Maybe that's the straights. I ain't gonna hold you.
You see? You see?
I ain't gonna hold you.
Real talk, because the number of young ladies that I have known to have HIV from heterosexual relationships, and it's like, oh, well, it's because he's on the DL. She was not. When they were together, it was heterosexual sex.
Right.
We gotta be mindful of
Right.
that.
I agree, and I'm so glad you mentioned that because honestly, when I'm having conversations with women about PrEP, that is one of the biggest barriers, is that they don't believe that there's any chance that they could be at risk. And so the conversation is often, you know, me trying to get us to a place where we can say, if you're having sex and you're having condomless sex with a partner who may or may not be having sex with other partners, then there is a chance that you could be exposed to HIV. It's bringing it to that level where this is not like in any way trying to shame anyone, judge anyone, or to make anyone feel bad about who they're having sex with or the frequency or number of people. It's more so, if you're having sex with one person and you're not with them all the time, you have no way of knowing who they're with.
So it's safe to say that HIV is not normalized in women?
No, not at all.
So I think it depends on the community you associate in, right?
Okay.
Because my friends are very well aware. However, I have a couple of friends who are in sexual health or women's health, and then I'm educated. So it's and by educated I mean by you. Like I didn't go to school for this, right? And so when we are together, there is common conversation, right? Because a lot of us are single, meaning unmarried, right? And so there, and then some of us have been cheated on. You know what I'm saying? So these conversations have had to come up. It's not that it's not talked about. It's just that there's a lot of misinformation.
Yes.
Kiana, I'm so glad that you mentioned though that you and your friends are having these conversations.
Yes.
Right.
Because for me, usually when I'm having this conversation with a woman, it's her first time ever hearing about PrEP, right? So if there is a conversation already happening between friends where one is sharing with another friend about their experience on PrEP or what they know, then that conversation when you're with a healthcare provider is much easier. Like we can at least have a conversation where this doesn't feel like something foreign. This doesn't feel like, something that is being kind of pushed on you in any type of way.
Right.
And we know in our community, medical mistrust and distrust is still a major issue,
Yes.
right? So if you can hear it from your friend or from your family member or someone you trust, then when you have a conversation with a provider, it kind of takes off some of that stigma and distrust that is there.
Yeah, and then having people in your circle, I really feel like I need to do a yearly thing with my friend because again, I just found out about that PrEP was for women as well. That's something that we should know. You know what I'm saying? Like not because we're reckless, but because life happens.
Right.
It happens to our young girls who are sexually assaulted. Like all of this stuff, and we don't know. Like never have we had something that we could take after being sexually assaulted to prevent HIV.
Right.
If it's out there, we should know. Like these are conversations we should have.
So, Dr. Moore, how do you access it?
How do you access it? So either through your primary care provider or through your local health department. I want to go back to one thing just very quickly that you just said, because I think one of the ways we can normalize the conversation about PrEP is to think about it as birth control for HIV. And think about it as this is our way of preventing HIV in the same way that you're taking birth control to prevent pregnancy.
Yeah.
Right.
And so when we think about it that way, I don't want to get HIV, I don't want to be pregnant at this point, so I'm taking this medication to prevent it. I think it's a simple way to explain that to people and to say there is no judgment that's being tied to that decision. It is your decision to make. It's your body, your choice.
But I think that's so important. When I was doing some therapeutic work with a dear friend of mine, Dr. Gwen Allen, who has the Women's Gardena Center.
She was my doctor.
Was
She
she?
delivered my daughter.
Wow.
Get out of here.
Wow.
You know that was my old college roommate. The best roommate ever.
No way.
Yes, it was my college roommate, Dr. Allen. We were went to UC Berkeley together.
Awesome.
And, yes. So she was the one. So we were doing an experiment about how do we bring therapy to our communities of color, especially with Black women. And you would be surprised how many clients she would bring me into the exam room and says, we need to get some appointments because she now has discovered, like you're saying, she now has at risk of transmitting this HIV to the baby, because her boyfriend, her partner, had HIV and he did not know. And so it makes all the difference in the world. This is a small world. So with that, we were looking at some different fundings that we can just, how do we make this, like you're saying, more real and get the knowledge and the information out there for more Black women so that they know, just women, period, that it's not a gay disease, it's not a male disease, but it's everyone is at risk. And how we have these conversations, how do we get them on PrEP and PEP and have these normalized conversations with us. So, yes.
But I think that teeters into relationships. And what we tolerate in relationships and the conversations we don't have in relationships. Because I know that being a Black gay man, there is no manual on how to date another man. There's no manual on how to even navigate a relationship. I know I can't speak for Black women, but my interpretation is you're raised up to be led by the man. Or the man needs to be the head of the household, whatever the man says you do. And then for most black men, you need to be the head of the household.
Right.
You know, and anything outside of that, you're now emasculated within your own community.
Right.
So when you think about all those nuances of how we're supposed to exist, and then you pull in the risk of HIV or any kind of STD, we don't talk about that. We don't address it. I know within the black gay community, of course, it's always about, you know, give me your stats.
Right.
Top, bottom, neg, pause, you know, drug and disease free, all that kind of stuff. But women don't have that luxury.
Right.
Because the minute you ask a man his HIV status, would you think I'm gay?
Right.
No, I don't think you're gay. I just know that I ain't your first.
Right.
Right. And not only that, but as women getting comfortable walking away from men who get upset about that.
Yeah.
Like, if I can't ask you your status,
There's
you
a
can't
problem.
ask me for you know what I'm saying?
Right.
What's some ice cream?
Right. If you don't want to go get tested with me, and I was dating someone and I was like, hey, Dante, we are coming
Right.
to be tested.
What y'all doing?
Right.
Right? And
I love that.
I'm not gonna explain.
Hey, bro, give me your finger.
But
Come
but
here.
that's
Give me your finger.
that we're normalizing.
Right.
Listen, we all have a past.
Right.
So let's
Right.
just make sure we're on the up and up so we can enjoy each other the best we can.
But it goes back to what we have seen. Those
Yes.
intergenerational relationships
Right.
that were, and I think before the camera started rolling, we talked about a lot of the intergenerational traumas,
Yes.
about the stuff that's swept under the rug, about the stuff we don't address, about the stuff that we're just told, no, that's just how it is. We all know the story about the auntie and the uncle
Oh, yeah.
at the family cookout.
Mm.
You know, they get into a big old fight. She busts him in the head with a bottle. He cuss her out, and the kids are still playing.
Yeah.
Right.
And all we
Because
say
it's
is,
normal.
oh, that's just them. That's how they are.
Right.
Right. No one sees it as domestic
Right.
violence.
Right.
They're just fighting.
And
So then
let's-
when we get into those situations ourselves, it's like, oh well, this is what we do. We
Right.
just cuss each other out and we belittle each other all day. That's healthy, right?
Let's not overlook what I feel like is also an elephant in the room, which is people, let's say the human race's desire to otherize people. As long as I can make that a gay disease or a white gay man's disease
Yeah.
or a twink disease, because I've heard that only bottoms, or I've heard you know what I'm saying. As long as we can otherize a group of people at our own despair, some of us will. Like, it's not that he's afraid that you really think he gay, but he gonna use that as the reason why he doesn't want to get tested. Because it's so easy to make the LGBT community the problem or the reason why this even is a thing, that as long as you are not a part of that community, you should be fine. As long as you're not doing what that community does, you should be fine. We're not thinking as black women that, well, if he's not DL, then I should be fine. No, it has nothing to do with if he's DL or not. But because that community is otherized or bastardized in our culture, we use that as the reason, the crutch, why we don't do what we're supposed to do as people. Like, as a woman who loves women, I haven't always loved women. You know, I've been with men up until, kind of fairly recently, let's say that. And
welcome.
I love men. Who doesn't love a black? There's nothing better than a black man. That's all I'm saying.
Let's be clear.
You know.
But at the same time,
Yeah.
you know what I mean?
Yeah.
But at the same time, being able to look at it from both ways, I see how some black women, they take comfort in the fact that their man is homophobic. They take comfort in the fact that their man is mean-spirited toward
Aggressive.
toward the community. So that gives them the reassurance that they are safe.
But it's a
But-
false
but-
reassurance.
But
False reassurance.
It's
Yes,
false.
it's
It's
a-
super
the
false.
more they angry,
The more
about it,
rah-rah,
the more they probably are likely on the.
they got a cousin or a homeboy,
Uh-oh.
right.
generally.
But one thing I just want to mention.
Yeah, out to Eddie.
One thing I want to mention, though, we know there are a lot of power dynamics in these relationships,
Right.
and I think, as I mentioned, a woman's body, a woman's choice is really important. So for even women who are in relationships where there is violence happening and she is concerned about him stepping out, she could be on injectable prep, for example.
Nice.
Yeah.
And he not have to know that she's on prep,
But she's okay with him
protecting herself.
cheating. She's okay with him cheating as long as it's with a woman. She thinks she's safe
Mm.
because he's only cheating with women. That's what I'm saying. Like,
But we don't
when
know
you
who that other
otherwise,
woman.
exactly. But she don't
Right.
care about that because her man
But that's where
Is,
the
you know.
education piece comes in. If this man is sleeping with that woman and now they are broken up, right? And then you find out, okay, he is HIV positive, never told you, and now you're sleeping with that man. That is how we're spreading. It's not a gay disease. That's why they keep saying, like, would you say it's the straights, right? Because of the lack of understanding and knowledge, and then the amount of shame that comes around it.
Yes.
Oh my God, you got it. Oh, you must be. No,
Right.
it's no way you got it and you not. Well, wait a minute, because it's transmitted through sex.
right,
If I am sexually active, I am exposed.
right,
That's-
period.
But we don't look at that in our community.
That was a breath of fresh air, how you gave women ownership in the transmission of HIV. Because for decades, that has been on the brunt
men.
of men, gay men. And then I am over the term DL. He's bisexual.
That's all
He's
he
just
is.
a bisexual man that
Who
is
hasn't
not out.
disclosed,
That is
right.
not out. And sister girl, if you never asked him, are you bisexual?
You don't want to know.
Because when are
That's
we?
the
When
problem.
Have
is
you ever had
when
sex
is
with a
one
man?
obligated
Do
to
you want
tell?
to? These are questions.
Yeah, and I
Right.
asked this question once to a room full of women. I said, would you rather be with a bisexual man that is focused on monogamy,
I was there.
or would you rather be with Tyrone that's gonna
Who's a
beat
hoe.
you, run up your credit, and he's a hoe? 99% of that room chose Tyrone.
Yeah.
Yeah.
They did not want monogamy because they was like, well, I can't trust that he's not gonna leave me for a man, but he's
But
monogamous.
he
He's
is,
monogamous.
but the Tyrone is constantly
Tyrone,
bringing you
yeah.
chlamydia,
right.
was it
Syphilis,
bacteria,
gonorrhea,
vaginitis?
Ain't paying his bills.
Ain't paying his
Oh,
bills.
right.
Ain't in your car. You done got
Yeah,
So
jealous.
you got an STD and bad credit?
Right. Right.
What are we doing?
But you don't want the faithful bisexual man who's never going to cheat on you.
Right.
You don't want that.
Right.
And I think that leads to a bigger conversation of how you say we other individuals based upon sexual desire. Kenta, you've been quiet. Jump in. It's like double dutch.
Hold on. We
Are you full?
We're refreshing our mimosas.
Yeah. Yeah. And a lot of what you said really goes back to the church.
Yeah.
Well, okay, so then I'll jump in.
I can tag it. I know you. I know you. I know you.
I think that the reason why I'm quiet is because I'm thinking about the larger discussion.
The big elephant.
I think that as a people in this modern day society, we're governed. Our moral governing is doctrinal. So if at first we believe a certain way, then we're going to behave a certain way towards all of the things that reflect whatever that principle speaks to.
Yes.
And so when it comes to sexuality, we're already a people who have been whether you say we've been conditioned, whether you say it's our tradition, whether you say it's just part of who we are, there is a history there that we don't handle sexual discussion and identity well.
But not to cut you off, Kim. But we have a $2 billion lawsuit right now because of sexual misconduct in the Catholic Church. And if the Black Church were to be sued, that $2 billion would seem like
A drop in the
workable.
pocket check.
But continue.
So take that same sense of concealment and now bring it into your personal relationships. That's why I said when you go
Oh, I get what you're saying.
a little bit further back into the way that we talk at our family tables, into the way that we teach our daughters and our sons about sexuality and health or not. Most of us are or not. It's incidental or accidental that I had a discussion with my child about sex. But I think that when we consider where we are right now on the timeline in the matrix, we are no longer in the 1900s. We don't have the same position to sit back passively about the discussions about sexuality.
Right.
We have to be more universal, meaning. So I imagine, I don't have a child. I do have nephews and nieces. And when I think about AIDS and talking to them about HIV, it's not about them dying. It's just about, well, you do want to live a long, healthy life and might have some kids, right?
Right.
You do know that there's things that you can contract that will interfere with your life, right? may not die, but don't you want to have kids? Well, don't get AIDS or HIV because it might create a problem for you. It may don't be so sexually free that you're not aware that herpes is so normal and natural in our environment that there's so many variations and forms of it that you'll casually get it and then you'll have herpes and you don't know it. So it's more to me about us learning to have holistic discussions about personal health. Yeah. And that sexuality is a really big part of it, and it is one of the main channels of contracting issues that get in your way. So I think that when we talk about whether we're talking about AIDS and HIV, we should be talking about all this stuff.
Right.
We live in a modern world where there's germs everywhere. There's all kinds of stuff.
Right.
So to eliminate the need to excavate one's sexual identity and isolate it because you don't behave this way. If you're an American living today, you need to know that part of one of the challenges that we face in having sex and relationships is AIDS. Period.
Right.
It just is.
But I don't think parents want to talk to their kids about that.
I do.
But I think it goes back to what you're saying. We still don't have enough information out there.
That's what I was gonna say.
We
I do.
lack how to have comfortable conversations, and we are not the best of having uncomfortable conversations that we may not know about.
Is
or
that
we
learned?
don't understand.
Is that learned? Because if Big Mama and them just said, don't go out there and get pregnant, and that's all she said. That's it. Don't come home with no baby.
That's correct.
You know, we ain't taught how to have a relationship. We ain't taught how to date. We ain't taught how to do this. Just don't come home pregnant. And then now you trying to pass on the same information to your child, knowing that there's an onslaught of terminology that needs to be shared with this kid, and parents want to be the smartest one in the room. Meanwhile, your child is on Google, Googling everything they need to know.
Or asking their homegirl, asking their homeboy.
With no guidance.
So it's
Right.
all of them sitting there with no guidance, sharing information.
Right. And you got young gay boys that think their sex life needs to match what they watch on OnlyFans.
Right.
It's like, yo, little homie, you do know you cannot do that every single day, all day.
Right.
You know they do cuts on them porn sets. They do this on them porn. You ain't just
You
gonna
don't
be
even tell me that.
right. So
And it's not Googleable.
and it's
Right.
not Googleable.
Right.
And you got little girls thinking that, okay, if I give it to him like this, or if I show this and wear this, he ain't going nowhere. He ain't gonna cheat on me. He ain't gonna do this. Parents are not having these conversations with these kids.
Well,
And I go on these campuses, and these kids are
They don't know.
knowledgeable. They knowledgeable in a very ignorant kind of way.
Yes.
That sounds really weird,
No, it's
No,
the truth.
but they are so smart, ignorant.
Let me tell
Because
you
they have
something.
knowledge without wisdom.
Right.
That's and as
You better
parents.
preach, daughter.
But real talk, I remember my grandfather saying like, knowledge is knowing tomato is a fruit. Wisdom is knowing it don't go on the fruit salad, right?
Right.
Like, we
Right.
Wait a minute, that was good.
That's some real stuff.
Yeah.
That's some real stuff.
Okay.
I again 3 daughters, right? So 20, 19, and 15. One thing I am most proud of about them is that I am not afraid to have an uncomfortable conversation. I'm not afraid to say clit. I'm not afraid to say none of that because what I told them was like, listen.
I was like, who's Clint?
Well, you know what I mean.
Clint.
Yeah, I know.
Oh.
It's okay.
Right.
So I said,
you don't have any daughters. It's okay.
It's okay. What I tell them is, well, the first thing is on my end, I have to realize that as a parent, although I love my children and want the best for them, I don't have any autonomy over them. Okay, I don't own them. I don't own their bodies. I can't tell them what to do with their bodies.
Right.
I can't make no rules for their bodies. It doesn't matter how old they are, if they're under 18, or as long as you're living in my house. None of that matters. Because when we were younger, we did whatever we wanted to do, regardless of who said what. It was our decision. So understanding that, I said, listen, when you're ready to take that next step and you're ready to be sexually active, I want you to come to me. I was like, give me a chance. The first thing I'm going to try to do is talk you out of it. After we have this talk, if you still say, hey, Mom, I know we talked. However, I think I'm still going to do it. Cool. Let's get you prepared and ready. Because I want you to win in every area of your life, even sex. I want you to understand that these gentlemen out here are learning most of what they know from porn. So they essentially are gonna jack off in you, and if you know what you're doing, then maybe you'll be pleased as well. But if you do not know your body, if you do not know what you're doing, you are gonna be laying there with a wet butt wondering what happened, and maybe if you do it again, you might get it right next time. Like, no, that's not how this works. Like, if you decide that this is something you want to do, we're going to talk about it. For real, because it's so many women, grown women, never had an orgasm. They don't know what things should or should not feel like, or whatever the case is. And I'm like, listen, I am just as not really wanting to, say certain things as you are wanting to hear your mom say them. However, if I don't say them to you, somebody's going to. And I don't know if the person that's saying it to you is going to want you to win in every area of your life.
Right.
So for me, I'm going to say what I normally wouldn't say to, I may not even have this conversation with my homegirls, but I'm going to have it with you because I'm personally invested in your success. And I don't want you to be walking around here not knowing what you're doing, And that I wasn't thrilled to have any of these conversations, but I understood how much they were going to be needed for them.
Wow.
And telling them all of the ways that I messed up because I didn't have these conversations.
That's good.
Nobody was there to have those conversations. It was, don't come home pregnant.
Don't come home
That's what it
pregnant.
was, and everything you learned about sex, you learned from your homegirls. Or if you watched the little BT After Dark or, something like that, but you don't really know. This is trial and error. So, I did want to be upfront with them. And it worked a lot, I would say, with my first daughter, because she called me when she was in college, but she called me when she had her first experience or whatever. And, my second one is in college now too. And now she told me she was able to tell me she liked girls. Okay, great. And then my youngest one.
Did you meet to her? Did you meet to her?
Right. I was like, I did. And my youngest, she took me through the most. She really tested me, how liberal, or no, maybe not liberal, but how free thinking are you, and how free thinking do you really think your kids are? Because she came to me at was it 13, Kiana? 12 or 13?
Outside the
You all right?
I'm so sorry, guys. So she came to me at 12 or 13 and was like, I don't know if I want to be a girl or a boy.
Oh, no.
Now, let me tell you something about the black community.
Okay.
We just now wrapping our head around gay and straight.
Tell you.
Okay? We definitely are not accepting of trans and, non-binary and all of that stuff. So,
Which is a huge disservice.
To that community and to ourselves.
It's a huge disservice because even this table should be a lot bigger, as far as these conversations go, because there's a lot of representations of us that are not here.
Right.
And sometimes, and even doing that, when we try to have these talks, you will have some like, wow, I wasn't included in the talk. What about me and how I identify? And I think that there needs to be a level of empathy there within our own communities about how diverse and how broad we are and how broad human sexuality is. But we boxed it in, gay, straight, bi, that's it.
And we're not very...
But we don't allow the fluidity of human sexuality to prevail.
I want to point to and applaud you for having the audacity and the courage and the common sense to have those discussions with your daughters that way. There's something I discovered about my past that I didn't contextualize the right way until I was older. I remember when I was probably about 8, and if I could have gone to my mom and told them, said anything about why I'm looking at little Tommy, I don't know if they would have been able to handle it.
Right.
Especially considering what I knew I wanted to do.
Right.
At that age. Right. Fast forward, I'm in high school, and I told a friend about this, and as I was telling her about it, I realized, this wasn't healthy. I met a man at the mall in the bathroom, and he was older. He had kids older than me. I knew that because he started to pick me up late nights on a sneak. I was probably 14. He would take me all the way to his house, and we would have sex. And he penetrated me, and I wasn't ready for that. I told that story to a friend recently, and they were like, "You were molested."
Right.
And to me, I was like, "What's?" Because
Yeah. Right.
That's the disconnect
Right.
with
Yeah.
black men, though.
I know we like to say nice cute words like molestation, but it was rape.
and so, but I'm telling you that as a young black boy growing up with that, with nobody to talk to, I couldn't go to anybody. I was growing up in a hyper masculine environment. In the South, all boys, a dominant mom, growing up in the Church of God in Christ.
Oh,
So the last thing I'm gonna do is go to anyone about these sexual explorations. And so for me, I normalize it, but there are so many boys who experience that don't get the privilege of coming out of it
right.
a certain way. And again, looking back, it was like there were a lot of men that do that.
Yeah.
And for me, it was normalized.
Yeah.
Who don't identify
Right.
as gay or pedophile or
Right. I knew that they had.
I want to point. I knew he had kids because I remember seeing his kids' photos in his house all the time.
But thank you for sharing that.
Right.
Because one, that's powerful. Two, we have made it seem like men cannot be raped.
Right.
right.
Because you're right, that wasn't molestation, that was rape. And that we can't have the safety of saying, I've not been raped. Because Dante has shared, and I'm sure Dr. Moore will too, time and time again, when these men have come forth, how the police don't take it seriously.
Right.
And especially if you're being a black man on top of that.
Yeah.
And that's almost seen going a counterculture of who we are as black men. But black boys still need to be protected.
That's right.
Yes.
And they're not.
And they're not. And so we have to, where have we, and that brings me, have as and I can say this as a parent, as of three and many godchildren, where have we gone wrong? Because of our own discomfort in talking
And
about
trauma.
it? Or have we all been, because we know that happens too. I would go back and want to know if I were in a therapeutic session, has he and was he raped at that age? Because we know that has a tendency of repeating patterns of that, because he did not have the cognitive fortitude to say, wait a minute, hell, he's 14, and why am I sneaking this 14-year-old boy into my house? Because someone must have done the same thing to him, till we now have come numb to that.
And then also, to just take it a step further, to even ask, of course, we don't want to hold the child accountable for anything, but what is it about an older man that attracted a child?
No. Come on.
Yeah.
Because if you're younger, and not
The daddy
but
syndrome.
you're younger, so what is it about this older man that you felt that it was not awkward, that this is comforting, this is okay? And I think that gets misplaced as well, because yes, that was a predator, of course, 100%. But then for the child or the teenager, because when I was 15, 16, 14, I'm looking at my peers. I got a crush on my friends. I never went to older individuals.
always older.
But unfortunately, my first encounter was with an older person when I was 16, and it was not welcomed. It was rape.
Right.
But when you think about it, it's like, well, what is it? What are we missing as young black boys, young black men? And that goes to the whole father situation, that's not even this topic. But I think there's aspects of our upbringing, our families, our dynamic, the sweep everything under the rug syndrome that we just continue to overlook. And all that plays a part into our mental and sexual health experiences. All of it ties in. When it comes to sex, what are we really looking for in the bedroom? What are we really seeking? I used to tell the young girls, when you hear love, legs open very easy. If a guy tell you he love you, all of a sudden, oh, he's the one. Girl, come on.
Legs open very easy.
Come on. But it's like, what are we looking for in the bedroom? When I think about the countless gay youth that are kicked out of affluent homes and forced to eat out of trash cans and sell their bodies to pay their cell phone bill. Meanwhile, their parents are living in the hills, but they don't want to have a gay kid. That's going to embarrass the family name or the legacy or the church.
Right.
Now we got kids out there having sex, situational sex, not in school, not working because they don't have a GED, they don't have any kind of papers. They're just out there pillar to post on drugs, using meth to stay awake so they don't get robbed at night. All these factors tie into one, survival, but it's also a longing for something. A longing for something they're not
And
getting
longing
at home.
often for the parents who put them out.
But parents put 'em
Right?
out.
Like you will put your son out for being gay won't address the family molester, molester, then you won't address the husband who is constantly stepping out. It's like and this is what my issue is with the church. It's the picking and choosing of the sin. This man can cheat on his wife with other people here in this congregation, but his gay son is no longer welcome. I don't understand that. This woman cannot sleep with her husband. The Bible only promises you sex during marriage. Everything else you're supposed to get. You're supposed to get your love, your understanding, your trinkets, all that before you get there. It only promises sex during marriage, and then you don't sleep with your husband, but your gay son is the problem.
Yeah.
I don't understand that.
Well, people like to gang up on things we can identify with. I mean, if we're being honest, like the men in the church can identify with that pastor that cheated on his wife. The women in the church can identify with the wife that don't want to sleep with her husband, probably because he's cheating or whatever the case is. But they can identify with that.
Or doesn't make her feel loved, appreciated.
Right. And you can identify with that.
Yeah.
But sometimes what you can't identify with is being gay. You can't identify with what they're feeling, what they're not feeling. It's foreign to you. You have no idea. So when you're asking people to be an ally, they have no idea what they're being an ally to.
Right.
And then when it's your kids, you don't even have that empathy for your kids, because again, you can't feel it. You have to really have compassion or empathy, and if you don't have any, then you're gonna kick your kid out. You're gonna, because you can't identify with them. Same in the church. It's cultural. Even though we say, we love God and God, Jesus is all. He is. Still though, we're okay with fraud, pedophilia, womanizing, whoremongering, backsliding, backbiting, shacking up, name something else. We're okay with it. We are just not okay with anything that has to do with the LGBTQ community, because as a whole, we can't identify with it. It's not right. It's just how it comes off to me.
I think that's the bigger piece of HIV prevention that goes beyond the condom.
Right.
It goes beyond PrEP. It goes beyond testing. It goes beyond all of that. It ties into the mental health component of prevention. And that's something that myself and Marty have been working on for the last 2 years. How do we link in mental health and sexual health? Because a lot of people are engaging in adverse behaviors because their mind ain't right.
Yeah.
But I think that's a deal with, when you hear that, one of the things when I was working with you at your previous place, they don't get the name, was really this whole idea of sex shaming. But they're like, well, I don't want you sex shaming. So I'm not sex shaming. I'm questioning why the behavior, because we cannot just not address the negative behavior and the risky behavior that could cost you your very life.
Yeah.
So too often we listen, like you said, you're grown, you can have sex with whomever you want. However, if your greeting to say hello is having sex with that person, there's a whole different reason behind that, and we need to get to the root of that.
And that includes marriage.
Yes.
When that's how you communicate.
Yes.
In marriage.
Yes.
If all y'all have is sex,
Okay.
we need to have a conversation
Yes.
about your trauma, about the misunderstanding of what a relationship is, about how y'all only friends when y'all screwing. Like that's a big deal.
How you keep that up, Jesus.
Right.
Stamina.
Right. That's a lot.
Viagra. More
So, I mean, we can go on and on, but I really want to just close it out with, what do we do next? What's the next steps? So think about that right now. Chew on that. Chew on it. Chew on that. And as we wrap it up, I mean, we've talked about a lot. We've talked about how you contract HIV. We know there's no such thing as gay sex. It's oral, anal, vaginal. Period. Period. That's it. We talked about that.
And cowgirl, and that's a position.
Oh, that's positions.
Okay.
That's positions.
All
We
Within the game.
Right.
Yes.
Positions. We talked about the access of PrEP and PEP for women.
Yes.
And Dr. Leo did a phenomenal job of just unpacking that PrEP is for everybody.
Yes.
That's good.
But clarify which pills are for which population. Because I know there's 2 pills for PrEP, but women can only take one of them, correct?
Yep. Women can only take Truvada. Women cannot take Descovy. currently. Women can take Apretude, though, the injectable version that I was mentioning, every 2 months. And it's an injection in the buttocks every 2 months.
Nice.
And then, in addition to that, Dr. Leo, can you just quickly talk about ARTs for people living with HIV and why it is so important for individuals who are living with HIV to be adherent to their medications?
It's a really, really great thing to bring up. So we call that treatment as prevention. And so one thing we know is that people who are taking medication, stay on their medication, get to a point where their viral load or the amount of copies of the virus in their blood is so low that it's undetectable by lab tests, they are unable to pass it on to others. And when they're at that point of being what we call undetectable, they also are at decreased risk of themselves becoming more immunocompromised, of their immune system becoming more weakened. And it helps them to live a long and healthy life. And we know that people living with HIV who are on treatment are able to live just as long as people who are HIV negative. So I like to say it's really important first to make sure that person is good, right? Make sure that person is on treatment, and not only for their HIV, but any other chronic medical conditions that they may have, because once the HIV is treated, often we're seeing people with diabetes, with high blood pressure, with many of those other common chronic medical conditions. It's not just about HIV. This is a whole person we're talking about, right? HIV is just one component.
Dr. Mark, I know you also address, I would love to, because a lot of times, one doctor. I would say that for finding your right doctor, your right therapist, or anything else, life coach or fitness coach, sometimes we have to go through several of them to get to the right one that's going to meet our need. And it's okay, and you correct me if I'm wrong, to interview your doctor, talk to your therapist, so that you know that they have your heart and meeting those things, because there's such a direct correlation between our mental health and our physical health and biological health. So if we're on top of that and we feel good about ourselves, we're going to have a lot more feel good about our mental health and the direction we're going, so we can live this healthier and longer lives.
Yeah, you have to shop around. I like to remind people that if you have any type of insurance, you are paying for a service.
Yes, that's good.
Right.
And if you're paying for a service, you should be getting the service that you desire. Right?
Yes.
And we also know that, everyone doesn't click. There might be a great doctor, maybe they know medicine, but you just don't connect with them.
Right.
They say things in ways that you just don't agree with. It's not comfortable to you. You don't feel that you can share with them what's going on in your life or what you're experiencing. Find another doctor.
Right.
In the same way, find another therapist.
Yes.
Find another until you get that team that you feel like, oh, these are the people that I can go to.
Your care team.
Yes.
And I think as Black people, we have a tendency to go, therapy is not for me. I tried it. It's not for me. No, that therapist was not for you.
Right.
But therapy is a totally, get another one.
Yes.
Right.
Yeah.
Don't give up.
Don't give up.
Right.
Don't
I
give
have
up.
therapy every Tuesday at 3 o'clock.
Come
I
on.
don't miss. I love therapy. It was literally the best decision I've ever made for my life. Started a few years ago. And I tell anybody who will listen, hey, if things going good, find a therapist.
Right. I love it. You don't have to wait till things are bad.
Right.
Yeah.
And if you start putting the good things in right now, the good habits right now, then when life happens, and if we know it will, you will have enough of the good stuff put in you to where you at least won't be falling apart when something comes up. So
And you have that person, right? To lean on. You're not scrambling at that time, because we know, unfortunately, there are not nearly enough mental health clinicians in this country.
Right, I'm trying to figure out
Qualified.
how she getting a meeting every Tuesday. Meanwhile, I'm like, this October? Okay. See, you did January? Gotcha.
Well, we probably want to start searching when the things are good.
Yes.
Because it's a standing appointment. Now you can't quit me now.
Yeah, I love
it.
Right.
And real quick, I want to also reiterate what Dr. Moore shared about becoming virally suppressed.
Yes.
Because that ties into you equals you.
Yes.
And a lot of people nowadays are ignorant to undetectable equals untransmittable. So they'll throw out a good person that's living with HIV to get with a raggedy one who's HIV negative. So that means if you're in a serodiscordant relationship, one person's negative, one person is positive, you're good. If that person's undetectable, they're adhering to their medications, you can take another precaution to get on PrEP.
How do we get people to believe that?
these kind of conversations. We have
Okay.
to normalize the discussions. So if you're HIV negative and you're on PrEP,
Mhm.
I'm living with HIV, I'm undetectable, guess what? You're not going to catch
Right.
HIV if we go raw.
Right.
No matter how I hit it, from the back,
And
the front,
for back-
cowgirl versus cowgirl, it doesn't matter.
You
You're
said
not
all,
going to catch
you
it.
gave us all positions and everything.
Yeah.
But we have to make sure we're adhering to
Period.
our prescribed
Right.
Yes.
doses of what we're
Right.
supposed to be doing and seeing it in the
Yes.
check. I just made it. I get tested every quarter. I'm in there. Take what blood you need
Yeah.
because I need to make sure I'm healthy. I'm even
Right.
doing a study with getting my blood pressure under control, and I feel the best I've felt in probably a good 10-15 years
Okay.
because I found the balance.
You got that rhythm.
Got the rhythm, and it makes all the difference. So now I'm paying attention to my body when I'm off. I'm like, oh, something's wrong. So like now take the time, like you said, I might need to journal. I might need to take a walk just to get myself rebalanced
Yeah.
so I can be the healthy and best version of Marty that I can.
20 minutes.
Yeah.
Yeah.
Walking.
Come on.
That's it.
Good change.
That's all. That's all it takes.
Leo, you want to say something?
Yeah, I was just going to say that I like to tell my patients your sexual health is your responsibility.
There
So,
we go.
regardless if the person is positive, negative, you don't know their status,
Yeah.
taking your health in your hands, your sexual health. So, knowing about PrEP, and if you think it's for you, getting on PrEP, right? Making sure that you have access to condoms as well, making sure whatever you need to keep you safe is being done, that you're getting your screenings, you know, and not just sexual health screenings, but all of your preventive screenings.
Yeah.
That when something doesn't feel right in your body, that you're going and talking to a provider, not waiting for someone else to even validate that, but you going ahead and talking to a provider. Because oftentimes, you know before we know, right? You're gonna know that something is not right with my body. You know it's not right. You know, you feel it. You should be bringing it to the provider.
I love that. And don't be getting rushed out.
Right.
Don't let them rush you out. Hey, no,
Your
wait a
10 minutes
minute.
is up.
Wait. My toe hurts. Let's talk about that while I'm in here.
Right.
Yeah, just wait a
Be
minute.
on my time.
All right, team. What's next? Who wants to go first? Let's wrap it up. What do we do next, Kiana?
All right. I'm gonna speak to the parents.
That's
right?
cool. I love that.
As parents, we got to have open conversations. We have to
Yes.
make our kids comfortable talking to us. Kayla and I do safe space. If she says safe space, I don't care what she tells me.
I love
All I can do. Okay.
And then you call me
And
afterwards.
then I call Dante. She was mentored.
Right.
Having a safe space, making sure our kids know that HIV is not a gay disease, having conversations with our friends, our families, our spouses, getting tested together as a family. Like, I know that this kind of stuff sounds like, oh my God, like that's so, PBS after school special. But that's the reason why they had the specials, because we had to open up conversations. And if you did it, then your family really can have a Cosby Show feel, right? Being mindful that the biggest problem with HIV is the lack of communication before it's transmitted. If we don't talk to our kids, they're going to talk to somebody else. They're going to have conversations. When I found out that when Kayla turns 12, I can no longer just go into her appointments. I about hit the roof. Because first of all, who the hell paying this insurance? I believe it's me. I'm gonna need you to document so I can see, right? But they're like, no, even online, you will not have access to her records. Me understanding how I am as a parent and how open I am, I also had to understand that there's another parent that will beat the hell out of their kid for anything,
Yep.
right? And so the safety of all children necessitates that my access gets cut off. So I'm not here to argue with the health system. I'm here to build my relationship with my daughter so that she never feels like she cannot have this conversation with me. It is not easy. As parents, we have to remember that nothing about the conception, probably the easiest part, right? Depending on how they were conceived, because positions matter. Okay. But conception is probably the easiest part. After that, it's all hard work. And we got to be able to put in the work so that our kids can benefit and we can change generations, because our kids, like them being able to say mental health, them being able to have, where they have boundaries that we never had. We didn't have boundaries with our grandparents cussing us out.
Right.
You know what I mean? Now kids be like, I ain't going over there.
Yeah,
Right?
Yeah.
And then we get mad like, oh, they're so disrespect. No, that's not disrespect. That's them making you respect them.
Yeah.
It's different. They can still be entitled to disrespectful though. Like, let's be
Of
clear.
course.
Like, I don't have to snatch a collar or two, okay? But at the same time, creating an environment where our daughters, our sons feel safe talking to us has to be our top priority.
Absolutely.
And then we have to be their advocate. As difficult as it is, I always tell my daughter, don't let nobody come tell me something about you that I'm supposed to already know.
Right.
So when she was on the playground in kindergarten, when I got there, if she was running, I'd be like, Lord, what didn't happen? Right? But she learned, I have to be the first one. Don't let this teacher make it to mama and she telling me some brand new information. You better give it to me.
That's good.
That kind of conversation allows our kids to go, hey, I'm coming to you first. And then be the safe space. If when they come to us, we cussing them out, we throwing stuff. You know what I'm saying? Now, I will say, hey, you know what? I need 10 minutes. I need 10 minutes. Mommy got to react. That might be 10 minutes to cry. It might be 10 minutes to call Dante and have him walk me off that edge, right? But she deserves that space, and I'm the one that has to give it to her.
Yeah.
I can't put that on her dad. I can't put that on her grandparents, her uncles. Like, it has to be me. And if we don't start doing that at home and in church,
Yes.
and in church, and in church, where we are telling kids, this is where you meet Jesus.
Yes.
This is where you get the compassion. This is where you get the
Yes.
empathy. This is where you get the love. This is where you get the understanding. Not that we are sanctioning anything that we feel is wrong, but you still have a safe space in talking to us about it. If we don't do that, we are going to lose our kids the way we have been separated from our previous generations. We don't talk about that enough. We don't fool with a lot of our grandparents. A lot of our grandparents died alone because they was assholes when we was little.
Facts.
You understand? And if we gonna fix that, it has to start with conversation.
Agreed.
That's it.
I love it. All right, who's next? What's next? How do we change this? What are we doing?
Kente.
Right, because I'm so interested.
Speak, Lord.
Please.
Speak to me.
You can even throw a song in. Like, I just want to hear the song.
Right. No pressure. No pressure.
And then you, because you smell so good.
I think that you said it. I think that it's important that we continue to cultivate real safe spaces for the dialogue, and to, notwithstanding the history attached to the HIV/AIDS epidemic in this country, but with all due respect to the lives lost and honoring those names,
Yes.
we also have to move in a direction where we begin to declassify that discussion away from sexuality preferences.
Yes.
That is what's making the difference and creating the disparities, because while we're constantly saying it's not a gay disease, that's how we treat it.
Yeah, absolutely.
And so I think that we'll do a greater service to ourselves and our children if we continue to evolve into having discussions about sexual health. I mean, sexual health is what's important, more so than anything, because there's going to be more alphabets and symbols added to that LGBTQ.
Listen, I'm not adding nothing else.
So true.
And that is just us unfolding out of this heteronormative illusion. And so as we see that continue to diversify, you're going to have to be forced to start talking about sexual health, because humans, we manifest in a plurality of ways when it comes to sexuality. And so sexual health is what's going to become, and for me is what I think is just terminology is important when you start to just separate it from sexuality.
Right.
Sexual health is important.
I love that. I love that. Queen?
I think more of this, honestly.
You just want more food, that's all.
That too. That too. What's going on?
And two things can be true at the
Right.
same time.
You know, this whole panel is so diverse And I think if this panel can be recreated over and over again, maybe this panel with an audience of people, maybe people who need to hear this the most, you know, women, you know, there has to be a way to educate Black women, because I'm not going to say that we're the number one carriers or anything, but I am going to say we be carrying it. So I think we should be listening, because, and like you said, take the stigma off. Lots of things have to happen, but mostly conversations like this that are very inclusive, that doesn't have anything to do with sexual preference, but sexual health. But this has to happen a lot more, and maybe in our own families, maybe, you know, maybe not at Thanksgiving, but maybe, you know, at, you know, some type of game night or some shit. Like, I mean, you know, like when everybody is there and it's a relaxed sort of environment, you know, where the tension is not heightened. We're just, you know, being that would be a good time to slide it in. I don't think it has to be something that is like made a thing, because when you make it a thing, then you'll get those people that's like, well, no, that's not for me because I don't, you know. But if it's just coming up at the family bingo night or whatever, we're all talking about it. So yeah, being strategic.
I love that. Love that. Dr. Moore.
All right, so I was thinking about this, and I think three areas: education, conversations, and relationships. So education, we really have to educate more folks about their body and about sexual health, so that they can have conversations with family and friends, with people who trust them, right? One thing that you mentioned earlier on was sometimes wanting to have a conversation, but maybe having discomfort about not having all the information, right? So if we can empower people to have the information, then you can at least introduce that idea and that conversation to people who you're close to, who are going to take that information from you in a way that they might not take it from me as a physician, right? And then my last point was around relationships. And I think being able to have open conversations in each of our relationships. So relationships with sex partners, relationships with romantic partners, relationships with family, relationships with your provider, relationships with your therapist, relationships with your pastor. Like really kind of pulling in that, being able to have that open and comfortable conversation with those people in those relationships is key.
I love that. Yeah, I love that. Martinez.
Yes, Dr. Moore took us to church with the ships.
Right.
So, I know my tagline that I say, well, sure, we got to speak up, speak out in order that we might be able to live. And I'm thinking speaking up is this. Having these conversations, speaking out, I believe, is going into the communities that we have influence over, so that we're now teaching people how to live. I'll be a little churchy for you. The abundant life, and how that we can live our best life without unapologetically living that, no matter what, because we all have skeletons in the closet. And we all can reach way back and go real deep and pull out some stuff we don't even want Jesus to know about. But as we continue to have, like you said, these conversations, so for those who are willing to come out to the horrible idea as far as we are, I will gladly host the next one for us. And so we can continue this conversation. And then maybe invite more people around us. We make this table, like you said this table needs to be larger. So let's have the larger table with the greater community, so we can make an impact on people's lives.
Yeah, I love it. I love it. But look that way. So, hopefully something was said on today that got your attention, that just sparked interest, that made you kind of think more critically about sexual health. And I think that's a phenomenal way to take it all the way, sexual health. We talked about the diversity at this table, but this is a small component of how diversity looks. I think there are many out there who have more to input than what we shared on today. But if that is you, hey, we would love to just sit down and talk with you as well. So to all the parents out there, know that you have an advocate for you that's really going to help you navigate those conversations with your child. For all those thick and witted, we have an advocate that's really all about, let's get this body together and just showcase the best that we got. For all of those who've gone through spiritual trauma, been just badgered by the church, we have a theologian here. We have someone here who can help you unpack that and just travail that pathway to find your best self. You know, however you subscribe or whatever spirituality you use, We can help you out with that. Then we have the phenomenal Marty Sellers, the CEO of Marcel Wellness Center, who can just help guide you through that mental journey. And I think that we cannot belittle the importance of therapy. Therapy is huge. We're in a very critical season. We're about to go into an even more critical season. And I think just making sure your mind is right, your mind is tight is so important. And we all can benefit from a solid therapist. And then for those that need to know more about HIV and STDs and what you need to do to make sure you're living your best sexual life, we got Dr. Leo Moore, who is always a go-to guy. You know, you can follow everyone here on our social media platforms. Matter of fact, give me your social media pages. What's your social?
Coach Kiana Shaw on all platforms. Or if you want to find me at Mothers Raising Teen Daughters on Facebook and Instagram.
I love it. I love it.
You can find me at TFLife365 on all the platforms, or thicknessfitness.co. No M at the end.
I love that. I think on social media.
Kente X on IG, KENTAYX on IG.
IG, okay. And then come on, because I know your social. Come on.
Mine is easy, at Dr. Leo Moore, Dr. Dr. Leo Leo Moore Moore.
And then
Mental Health Marty.
Marty, and I'm Dante_Morrison on Instagram. And then this is going to be out on all of our social media platforms. So we're going to ask you to please share it. Let's make this conversation go viral. A lot of information has been shared today. We've probably been saying some things you've been thinking. So it would behoove you to be a supporter of this. So shout out from Marcel Wellness Center. And then please, special shout out to the HIV Vaccine Trials Network, who is making this possible. So please visit www.hvtn.org. HVTN.org is a global think tank of researchers that are researching HIV vaccines, tuberculosis vaccines, a lot of other vaccines globally. So HVTN.org, and then Marcel Wellness Center, www.marcelwc.com, MARSELLWC.com. Check out both of those websites. Get your life together. Let's help you get you back on track. Group hug to you. We living on you. Because sometimes we all we got. So just know that you are a part of a village, and we are that village that loves and supports you. So you got a team behind you. We're gonna help you get to greatness. All right. So thank you for watching this.
And shout out to Eddie's Edibles.
Oh my goodness! Shout out to Eddie's Edibles.
Right, because I've been to that. Like, what is happening with my textbook?
Kudos to Eddie's Edibles. Follow Eddie's Edibles on Instagram and Facebook. That's Eddie's Edibles. Shout out to him. Thank you, Eddie. We appreciate you.
I didn't like anything. I just ate it because we were on camera.
And then Marty, give a shout out to our crew.
Yes, our crew. Henry Jones and Lester himself. We have the best crew that does all of this for us. They are remote. For a small fee, you too can have them. But they are great, and I appreciate love to the fam with that.
Love it, love it, love it. All right, y'all. So there's going to be another one. I know Marty. It's going to be another one. So stay tuned for the next one. That's all we got. Happy World AIDS Day 2024. Peace.